Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of their respective employers. And now, here's Dr. Bradley Block.
And now a word from this week's sponsor, Laurel Road.
Taking out med school loans had me watching every penny. I took 2 buses to get to campus. During my residency, I walked 20 blocks. But since I opened a Laurel Road linked checking account when I refinanced my loans, I got a crazy low rate plus a cash bonus. And all that extra money helped me finally buy my own car.
Where are we going?
Anywhere we want.
Laurel Road for Doctors. Banking, insights, and benefits uniquely designed for doctors. See laurelroad.com/doctorchecking for full terms and conditions. Laurel Road is a brand of KeyBank N.A. member FDIC.
Dr. Amy Vertrees, thanks so much for coming on the podcast.
Thank you so much. I'm so glad to be here.
So, I've heard you talk about this before, and I love what you have to say about it. So I want you to share it with the audience. What are the keys to fulfillment at work, right? We often talk about like happiness. I want to be happy. But really, happiness is more of like a transient state, whereas fulfillment is more of like a prolonged state. You know, I find my job fulfilling. My job doesn't make me happy, right? So what are the keys to being fulfilled?
Well, I'll first start with like happiness is like truly a trap. I mean, if we are going to our job to seek happiness, good luck with that. And I think that's an unfair pressure to put on our job. I'm much more like the more practical aspects of the idea of mastery and recognition. And this is a concept that I picked up in How Women Rise by Goldsmith and Goldstein and Helgeson, where they talk about, actually reference something else's work, about mastery and recognition. And what mastery is us being good at our job. And, that's something we have control over. We study it, we work on it, we practice, we get better. As surgeons, we work on our techniques, we seek other people out. Mastery is something that we can do, that is within our control. Now, recognition is something that's different. Recognition is something we have to get from somebody else. And there's this idea of, when we do a good job, we want someone to notice. And this is not I'm seeking someone's approval because that's, as a goal. You can seek someone's approval as long as you're unattached to that outcome, meaning that, we all want recognition from our job. We want to be good at our job. We want other people to notice and tell us. But that's where I think some of the dissatisfaction comes from, is if you're kept from doing good at your job or you're not recognized at your job, that is not going to be a good formula for our job satisfaction. And, it's helpful for us to understand that's what we're looking for, and when we're dissatisfied in our job, trying to understand, am I not good at my job, or is someone keeping me from being good at my job, or am I not getting the recognition I want? And sometimes that's simply of, finding the key to either of those. But it's also a key in interacting with other people in the world. And this plays into things like delegating of, are we interfering with someone else's mastery and recognition? And typically, like when we're trying to delegate people, we a lot of times have a hesitation for delegating, thinking like, well, I don't want to feel like I'm dumping on somebody. I don't want them to think that I'm not doing work. But what we're really doing when we don't delegate is that we're not giving a task to someone to gain mastery or demonstrate mastery. And we're also not recognizing them. So we're saying, not only am I not going to give you this task that's going to allow you to be good at your job, it's going to rob you of any recognition too. And that very, very simple concept really transformed how I felt about my job and also how I interacted with other people in their job. It made it so much easier to offload some of the work that I really wanted to offload, and recognizing that was actually essential.
So then you're allowing them to gain mastery. So what you're referring to, really anyone that we work with, correct? Like whether it's a medical assistant or an advanced practice provider or our trainees, really anyone that you can delegate to, but not. So then what's the difference then between delegating and dumping? Because it sounds like some of it's dumping, and you're kind of rationalizing dumping because you're saying it's well. It's actually helping them gain mastery of faxing this chart to the other doctor because we still fax stuff, right? Like, how do we distinguish between the two? And also, I think in many situations, dumping is okay, right?
Yeah.
Like our time is really valuable. We're highly specialized. We're highly trained. So it's not like it's other people's jobs to do some of this stuff. So sorry, that was a lot and not really a focused question, but I feel like you know where to take it.
I totally know where to take it. Yeah, I mean, it's absolutely true. And I think a lot of it is the mentality of it too. It's like, whose job is it? Me as a surgeon, should I be faxing things? And, it in some situation, I don't think so at all. And I think it's recognizing that everyone should be practicing within their job description and the top of their license, and I think that recognizing that, and then we're all going to do some element of dumping, for sure. But, it's recognizing, should I be faxing this? Or should my nurse be faxing this? And, like, whose job is that? And I think,
Or maybe not even the nurse, because the nurse has enough to do that's
yes,
up to their level of training. So we need to hire someone that doesn't have the training of a nurse to do the faxing, right? So everyone's kind of, you're escalating what everyone's doing so that they're working to their full potential.
and that's a great point too, because I think that we also can let them have some autonomy too, is say, like, I have this fax that needs to get done. I'm going to give this to you. I don't care how it's done, as long as someone faxes it. And, I do that a lot in my office, where I will sometimes give it to the exact person who I know is going to do that, or I give it to my office manager and said, take care of it, and that's sort of recognizing their job as a managerial thing. And, that's, typically how I handle stuff is try to empower the people around me. And I did not realize that this was a huge misstep that I made in my initial office. My transition from employed to private practice was really built on my dissatisfaction with the clinic. And, I found a lot of flaws in the people that I worked with in clinic, and I did not like the relationship that I had with them. And it wasn't until afterwards, when I sort of recognized this concept, how much of a role that I played in that dissatisfaction, because I came from a system that was relatively broken. I was used to doing the faxing and the workarounds and the things like that. I was used to doing all of it. And, I'm not a control freak at all, but I just like to know everything's getting done. And joking, but so really what happens is, like, when you kind of grow up in a broken system and you're doing a lot of things, it's hard to delegate stuff because, and sometimes we think it's easier, and it is easier to do that. But what I was doing was I was robbing them of that ability to feel useful. And, I was also robbing them of the ability to get better or feel like I was, feeling that they were of some use. And, so I fed into that dissatisfaction, and I've changed by just being very conscious of how I interact with someone. That was one evolution of, my job satisfaction and helping someone else's job satisfaction. And one thing that, as I've been trying to get better with delegation, which has always been challenging, is this idea of, I tell a task and I do it in all the details, and then I get frustrated that it doesn't get done, and then I'm starting to recognize that I'm delegating a task, but I'm not necessarily delegating my thought process, and recognizing that, it's more than just the steps, and it's more than just, do these steps 1, 2, 3 kind of thing. It's me letting them know, this is how I do it. Or I give them tasks and I say, why don't you show me how you're going to do it? And so recognizing how they interact in the job is really helpful as well, because people are not going to do everything like we do. They may actually do it better, or they may not. And we need to know how to overcome their limitations as well. And so, really interacting with people and, paying attention to what they need and how they can help us. This interaction is something that's so critical in job satisfaction, not just for us, but for them as well.
I feel like there's a parallel there with loading the dishwasher, right? Like this is how you load a dishwasher. People like this. You say how I'm doing it. This is how you do it. No, you're doing it wrong. You're going to have to do so many, you're going to have to run it so many more times. It's so much more, but like, really, just let someone else run the dishwasher. Okay. Just because they're not doing it like you and you do it right. Nobody else knows how to do, just let someone else load and run the dishwasher. And there's so many things in our lives and our practices that, are amount to that. To me, it's a game of spatial relations. I actually don't hate loading the dishwasher, but I see how much I can fit in. But I think that works in this situation, right? Like a lot of things that run a parallel to that.
Well, I'm sitting here wondering, why is he attacking me? Oh, say, let me just tell you about the dishwasher.
It's everywhere.
I just get in there, I just get it done. Put the dishes in the dishwasher. My husband will unload those and put them in a particular order. And
That's me. I'm that guy.
Well, at first I was like, what the heck? But then this is actually a really great example, because then he showed me his thought process. He's like, if I do it this way, and then, it'll be easy to offload and this and that. And, and I'm like, oh, okay, fine. So it wasn't just him telling me what to do. It was having him share his thought process. And then I bought into it. It's like, now I'm like, okay, fine. I will spend 2 more seconds. Or let's be honest. Now I just plead ignorance and still let him do it. But
Yep. Delegating. Yeah. That reminds me of a Shel Silverstein poem. If I do the dishes and I drop one on the floor, maybe I won't have to do the dishes anymore. Oh, no. I don't know how to do it. You know how to do it right. You do it. So I love that mastery and recognition, you really spin it on its head. Like for fulfillment, you use it for yourself, right? But then you use it for your staff as well. So mastery and recognition are important for them. So one, give them situations where they can feel like they have mastery, not like a, derogatory, like where they actually, it's a challenge for them, and then give them recognition. But for yourself, I want to pull these apart from the physician for us, right? So like mastery, how are you defining mastery? Because I could see like, you're a general surgeon, I'm an ENT, overlap here with like thyroids, right? So we both do thyroids. There are some people out there that just do thyroid, parathyroid, right? That's their whole practice. And so they're going to but they're not, they're going to conferences to make sure that they're learning the latest and greatest, but, they're still, I'm not sure how you can really push the envelope with something like that. Whereas, another type of, you're learning advanced robotic techniques and doing things that other people haven't done. Like, is that what you have to do for mastery? Or can you just do the same stuff that you've always done? And that's also considered, like, how are you defining mastery?
Oh, I think, gosh, what a great question. And, as you were talking, I was like, well, how do I do that? And for mastery, for me, is just basically the statement, I'm good at my job. And this is a feeling that you get. This is a thought that you offer yourself. This feeling of satisfaction comes from the thought, I'm good at my job. And the only person who really can determine that feeling for myself is me. And if I decide that all I'm going to do is this procedure, and I'm satisfied with it, and when I go there, I get a sense of accomplishment, then that is mastery. And so we can be recognized from other people, but the mastery is a thought that I'm good at my job and a feeling of satisfaction, and it's only something that we can generate for ourselves.
Got it. Okay. So and then the recognition, I have to push back on a little bit, right? Because that sounds like you need external validation for fulfillment. So is that really what we're saying? What you're saying, that we need this external validation? Because all the other, can we call them new agey? But fine, new agey types of things is like you should only need internal validation. You shouldn't need external validation. It all should come from within. Or are you saying actually we're human and we do require external validation? Let's just own up to it.
Totally. I think that we all are seeking approval. I think that we all would like approval, but the people I think that are the happiest are the ones that are not tied to it. Like if you go to a job and you're good at it and no one ever says anything, I think that'll be an okay-ish job. But if you go and you do it and you're happy with it and others like, hey, I like how you did that. That really makes us feel good. And, I do think that we're all at some level really wanting approval and, wanting to feel something. And, other people can only generate that feeling for us by, what we think of what they say. And because you can imagine well, actually, it's a really interesting question, because as surgeons, and I try to really help the folks I talk to, that our patients tell us all the time they're doing a good job. Like we just don't listen to them. We're listening to many different people, or listening to the negative aspects of it too. But I try to remind folks to listen to the positivity of rounds, and like even just write it down, like what our patients say on rounds, because we don't hear it. And so we go to work going like, why doesn't anyone appreciate what I'm doing? Yet we're completely ignoring all the person. I mean, and I started writing them down, and I encouraged other people to write them down too. And, even just like on one rounds, like them saying, you're a gift to me, you saved my life. All these things, and I never actually heard them before. And so, and I got a little bit off your question, but, we go.
No, that's the external validation. Like you're like, the question was, do we really need the external validation? Shouldn't it all be internal? And what you're saying is, let's be realistic, and it's out there. It's out there. It's out there. Just look for it. And what you're saying sounds similar to what we hear about gratitude, in that, the brain is a threat detection machine. And so we only really, we've evolved to hear the negative and not the positive, because we're designed to just not die, right? So anytime that we get a negative Google review, or someone complains about how long they've been waiting, or, they don't like their scar, whatever it is, like that really stays with us. Whereas the 40 patients before them that are like, doctor, you're the best. You're so amazing. Thank you so much. And, oh, the reason I'm here to see you is because my 13 best friends all see you, and they told me that you're the best person to see, right? Like, and so we don't remember these things. And so what you did, you started writing them down as a way to train your brain, which is what gratitude journals are, right? Just a way to train the brain to recognize the positive when it happens.
Yes. And, in answering your
By the way, I
question
don't gratitude journal. Sorry, I'm a complete hypocrite. I'm saying how great it is, and I don't do it. I tried and it didn't. So, but sorry, continue.
Well, I think, I guess the question is like, how does it help? And it does help, but we don't have to necessarily do it all the time. But sometimes we need frequent reminders about how that helps. But to answer your question, do we need it? Imagine a clinic, like 2 clinics. Oh, I'm sorry, office hours, because we talked about this.
Office hours, yes. It's not clinic, it's office hours. Maybe in that place that you used to work, that's all broken. That's the clinic. You don't want to go to the clinic. You want to be seen in my office hours. Yes.
Exactly. Sorry. Imagine the office hours where you go there and you're like, you have a hernia. Okay, we'll do this on Friday. And then that's it. And they come back and like, I fixed your hernia. Okay. And versus the, like, I was in pain before, and now, I feel so much better. And it took me a while to find someone, all these other things. That's basically approval that we're getting from someone. And you can imagine office hours where you just hear like A and B and head whole, fix whole, versus, the other thing where you get a little bit of a feeling from someone because they offer something that's meaningful. You can see that one's a job and one has a little bit more satisfaction to it.
Yeah. Yeah. Just have to make sure we keep our eyes open and adjust our tuner a little bit so we can hear it and recall it.
Not fall into the trap of relying on it, just like you mentioned, like the threat of it. So we have someone that comes in and says, like, you did not fix my problem. And like, well, I know you had a hole, I fixed your hole. And
is that general surgery in a nutshell?
Yeah, pretty much.
Well, closing holes, fixing holes.
Yeah. You have a hole, patch the hole. That's broken. Let's take it out, Yeah.
So one of the things, I'm going to give myself a little validation. One of the things I tend to be good at, I think, is there aren't many non sequiturs in my interviews. I tend to have a list and I'm able to roll one question kind of into the next one. At this, I'm not. I apologize. This is a complete non sequitur. Let's move on to the next topic. And the next topic is difficult partners.
Oh,
right?
yeah.
This is something that you talk about frequently. So
Yes.
I think one of the keys to fixing a problem is identifying the problem. So let's start out with, when you say difficult problem, what does difficult mean? What are the ways in which a partner can be difficult?
Oh, a partner can be difficult in so many ways. And this is another thing that we have a perception of, and I think really understanding and asking the question, why do we think they're being difficult? And let me give just like the simplest thing. My partner is difficult because they ask for all this time off, and all I think about is themselves. And then I'm like, well, why does it matter that they ask for so much time off? Well, because they're just thinking of themselves. So they should be thinking of you.
Well, they
And
could be a little more considerate, right? Like your partners, you should be taking into account that I'm having to take care of your complications while you're away.
yeah,
Difficult partner.
yeah, it's just interesting to kind of like challenge them for a bit. It's like, I'm so sick of them only thinking of themselves. Why don't they think of me?
So then what do you do? What do you do in that particular situation where it seems like the person is really not is only looking out for themselves? Do you then change your thinking? Because it sounds like that in that situation, that person is probably trying to be considerate of that other partner's time, trying to be considerate of their family life and other responsibilities. And so do you then try to be more selfish and just look out for yourself? Like, how do you react to that type of difficulty?
Well, it's recognized the fact that a lot of times we're having this conversation in our head.
Mm,
Like the partners over there, they just submitted this piece of paper that asked for some time off. So they're over here in the corner. Whereas we are looking at the sheet, having all kinds of dialogue of they are only thinking of themselves. Why did they ask for this? Why don't they ever consider me? And that it's a lot of internal drama that it really is just a lot of suffering. Whereas if you say, like now I'm only thinking of myself, but really, it's like if there is a problem with a partner, like once we get out of this idea, like they are such a problem, then we can kind of back up and say, like, well, maybe they just don't know. Like, maybe they don't recognize that I actually have a life too. And, we can actually maybe sort of like not make a lot of these assumptions about what they're doing and say, hey, I noticed that you asked for this weekend, and I'm noticing that there's more time that you're taking than I am. And is there a way for us to even this out? I mean, it's just kind of making the assumption that they're not this terrible, awful person, that they just don't know. Once we drop our dialogue about them, that's typically just a little bit in our head, because what happens is that we build this resentment, we create this story about them, we have all these things about them. And so then what happens is we interact with them from resentment and frustration, and then we become the difficult partner.
it sounds like you could be a marriage counselor. That's what this sounds like. That doesn't sound like managing a difficult partner at work. That sounds like managing a relationship at home, right? Like, you know, the person isn't doing what you expected them to do. So you have this whole argument in your head and you're, blah, blah, blah. And then you actually have a conversation about it. Turns out that everything's much better than you thought it was. So,
Yeah.
okay. Verbalizing, but those conversations are uncomfortable, inevitably, right? Starting that, you took this extra weekend. You knew that I had to go to my nephew's bar mitzvah and you took it anyway. And like, those are hard conversations. How do you get comfortable being uncomfortable? I don't want to be uncomfortable.
Well, I think that really is that, do we have to be uncomfortable at all? It's the idea of understanding like the thoughts that we're having in our head and how they make us feel a certain way. My resentment for a partner asking for more time off is just based on this thought that I think they're being selfish. And I mean, is that thought even true? Like, if we change this thought of, I think they're just being selfish, which leads me to resentment, and just say, like, how do I want to feel about this? Maybe I want to feel curious about this. Like, I wonder why they ask for so many days off. And I wonder if they even know that this matters to me. And really kind of embracing and really feeling a feeling that we want to feel like, and if we want to feel understanding, or if we want to feel, respectful, I mean, these are feelings that we can have about someone. And if we're feeling curious and, grateful that we have a partner, if we look at these emotions, we can approach that interaction in a way that's going to be so much more productive. And if you are feeling curious, are you feeling respectful, it is to go to the person and say, like, I noticed this, and I just want to bring this up to you. I really just need to talk about it. If we really kind of channel the feeling that we want to have, that other person is going to feel that. And if and this is, Never Split the Difference. Chris Voss is a fantastic book of, the tactical empathy. Like, I know that you probably have something going on, but I do as well. And I really want us to come to an understanding, and is coming at it from a place of, curiosity and respect. Will ask us this question versus a resentment of, like, I mean, why did you ask for this weekend off? I mean, you had to know this was important to me. Why are you asking for every weekend off? And it's so funny because a lot of times we don't say that, but if you're like channeling it from your brain, like, like when people are thinking something. And I was coaching someone who's like, I'm interacting with this guy and I think he's an idiot. And he's like acting so weird towards me, but I never said he was an idiot. I'm like, but did you?
I have trouble covering that up. Yeah, I have trouble.
Well, yeah,
I
we
have
all
no poker
do.
face. Yeah.
And so I think that the key is that you truly have to believe in the outcome that you want. Like, do you really want to win this argument, or do you really want to have a partner that you could have a good relationship with?
Yeah.
And it could be difficult when you have someone that you don't understand. I, for the last 5 years, have had a partner where we are like wildly different. And it was very frustrating for a long period of time because I wanted him to act a certain way. I suspect he wanted me to act a certain way. And it took a while to get around to the fact of just recognizing that we just do things differently. And nothing's gone wrong.
Can you get him to load the dishwasher?
I think we would agree to pay someone else to do it.
Got it. Okay. Okay. So one of your other talks is 12 habits holding us back.
Oh, yeah.
Rather than having you give the entire talk, just pick one. Just pick one. Give us a highlight. Give us a taste of one of the 12 habits holding us back and what we can do to change that habit.
Oh, yeah, 100%. This applies to all doctors. It is overvaluing expertise. And that is imagine, I think something should happen in the hospital. And I charge into the CMO's office and I was like, I am the surgeon. This should change. We think that matters, right? We think that we should have some say in something that happens in the operating room, right? We're doctors, right?
Yeah.
Nope. That is the power. We have the expertise, but that is only one of the 4 powers in an organization.
Okay.
The power of expertise. So not only is that only 1 out of 4, but it's not even necessarily the most important. It's the power of expertise. It is the power of position. I'm not in a position to make that. It is the power of connection, the people that you know, and building allies. And it is the power of charisma. It's our ability to influence other people, the power of influence. And so us charging in there and saying, I am the surgeon, you do what I say, is not going to get us anywhere. You have to channel all 4 of those. And if we don't have the position, we need to be friends with the person who does. And so overvaluing expertise is something that I think that we, especially in medicine, feel like we should be making the decisions. And I think we all know that we are not making the decisions these days.
I've earned it. I paid my dues. You should see what I do all day. You should see the risks that, the stress that I'm under, and I should be able to make these decisions. We did a podcast a while ago with another physician coach who had talked about how to get allies. And, I thought it was really interesting because when I was a resident, right, you've got your list of things to do, you triage it, list of to most to least important, and then you get to work. And if someone's going to talk to you in the hallway, they're going to be wasting your time because you got stuff to do. However, those are potential allies. So the chit chat in the hallway, that chit chat in the doctor's lounge is another rung of those 4. So now you've got the expertise and now you've got allies too. Why? You chit chat. You ask them about their kids, ask them about their family, ask them about their vacation, how there's a weekend, whatever. Those look like new shoes, right? So, but that was, it's an easy way to add something else to get more of what you want done in the hospital.
Yes, but that leads to another one of those habits, though, which is failure to leverage relationships. A lot of us, especially women, are very good at building relationships. We are not very good at leveraging them. We don't want to ask people for favors. We don't want to say like, hey, I know we talked about our kids and all too. Hey, why don't you help me out with this? We don't want to ask for things because we feel bad about it, but not recognizing that leveraging a relationship is not bad. It is not recognizing the fact that we can offer something to them potentially as well. And so building relationships is one thing, but you have to be willing to leverage it as well.
Hey, do you think you can help me out with this? Gives them an opportunity for mastery and recognition.
Totally.
So the callback To the beginning of the episode.
Exactly.
Excellent. So before we started the recording, we were talking about our kids and negotiating, right? So it seems, and the conversation that we just had with the imaginary person in the hallway could even be a bit of a negotiation. Hey, can you help me out? You scratch my back, I'll scratch yours, something like that. So it seems like everything is a negotiation. Is everything really a negotiation?
Yeah, I mean, what is negotiation really? It's just a conflict. And, we have negotiations internally in our head. And we have, like, for example, like you some in the hallway, that's a negotiation with yourself. Do I run and hide because I don't want to deal with it? Or, this internal part of us that wants something from that person, or feels like we want an outcome that that person could help us with, that is a negotiation that we have with ourselves, of like, is this safe or should I run? Is it worth it to interact? Or, like, those are some of the negotiations, because negotiation is just a conflict. And that could be internally, it could be with the other people. And, it's sometimes it's a perception of whether there's a conflict or not. But typically, like, we're all trying to navigate getting something that we want. And, not everything is guaranteed to get what you want. And there's where the conflict comes in. Is like, is it worth it to do whatever? Or should I not do something?
Hmm. Yeah, I never really thought of it that way. I never, um, it's interesting to be able to view things through that lens that maybe you didn't view as negotiation or even as conflict, right? Some things really are conflict, but they're not quite as adversarial, so you don't
Yeah.
necessarily view them that way. Yeah. Um, so there's one more thing that I want to talk to you about, and as surgeons, I mean, I call myself more like surgeon light. I'm not really. I never like we had to
Oh,
delay this interview because you had a surgery that you had to add on, so we had to do this a different date. Like that never. I'm an ENT. That doesn't, at least in my practice, that doesn't happen to me. But I still do have complications, right?
mhm.
There's a saying about tonsils. If you're not getting tonsil bleeds, you're not doing enough tonsillectomies. So tonsil bleed isn't necessarily a dig at your skill or mastery, or lack thereof. But if you get a couple tonsil bleeds in a row, then it starts to erode at your confidence, right? So how do we mentally grapple with complications?
Oh, I love this. It starts from the informed consent. And this was like a mind-blowing concept to me when I thought about this. So we give this informed consent. We're required to give this informed consent. We think it's the right thing to do, to tell the patients all the things that are going to happen. And we ask the patient, do you consent for this procedure? Do we consent ourselves to accept that risk? We tell ourselves it's not going to happen. We tell ourselves, I mean, if someone asks us, well, you can have a complication, sure, but in our mind, we don't think it's going to happen. And I think, taking that moment to recognize the fact that something might happen is the first step, is that we're arguing with reality if we don't. So preemptively planning how we're going to deal with the complication is probably the most helpful. How am I going to deal if this patient has bleeding? Am I going to be okay with that? I injure a surrounding structure. Am I going to be okay with that? This patient could die from allergic reaction that, or malignant hyperthermia. Am I okay with that? We have to really recognize that we're resisting reality if we think that this is not going to happen, whether it's 1 or 100, but certainly every case we do buy is more lottery tickets for that winner.
There are a lot of callbacks in this episode to previous episodes. And one that, that reminds me of an interview with Stacia Dearman, who talks about, she's a pediatric emergency medicine physician who had, the worst complication that someone could have. And she talks about practicing medicine after that, like coming back and seeing patients again after having the complication of all complications. And that's what I'm hearing from you. And one thing that she said was, um, you know, the we do hard things. We do hard things. And that's what you're saying. You're saying we could get complications. If I'm not okay with that, then I shouldn't be doing this. So I need to be okay with that. And that's what she said. She said, every day we do hard things. We put ourselves in harm's way our patients are the one really in harm's way, but it can affect us and it can infect us really, really deeply. And we have to be okay with that. Otherwise, we can't continue practicing, and we have to accept it, and we have to recognize it. And I think that allows us that recognition that we do things that other people can't do, that other people wouldn't be willing to do. They wouldn't be able to get up the next morning and continue doing it, but we're doing it. So having complications is one of those things. It will happen, and you got to be okay with it. And I think internalizing it before each surgery, when you're consenting the patient, is a really maybe it's poetic, or it's just a really nice way to do it, right? Going through it into your head. Am I okay? They're okay with it. They're saying they're okay with it.
Yeah.
Am I okay with it?
And the other piece is to ask us, what does the patient really expect of us? And, and we expect a perfect outcome, and that's the problem. We think that they expect a perfect outcome too. But, if you really think, what does the patient want? After a complication, what does the patient want? They've already consented to the possibility of it. They heard us because they only heard it once. We say it like hundreds of times to forget it, but they heard us when we said that. So I think, the most success that I felt after having, if you could have success after a complication, is when someone says, you told me this might happen. And so then I knew that I set the expectation, which reminded me of the expectation. And the fact that we discuss this ahead of time is the most helpful thing, is preparing the patient for the possibility, in the case, doing the best that you can, and afterwards facing the reality of whatever happened. And so when they say that you told me this could happen, then, they acknowledge the fact that this was accepted ahead of time. So we should acknowledge the fact that this was accepted ahead of time. And the other aspect is, what do they really want? When you talk to someone who's had a complication, and I had someone that came to me, had a complication, her biggest frustration was they never called me afterwards. They never told me what happened. The op report is missing. I've asked them details and they shut it down because they thought she was going to sue. So she heard nothing. She's like, I just wanted to know what happened to my body. And so what patients want is to know what happened to them. They want to know that you're going to be there for them. They want to know that you care, and they want to be supported through this. And they need that, and we need that.
Yeah, nobody likes to see their own flaws. Nobody likes to see their own flaws. So if you have a complication, that flaw is going to walk back into your office, and you're going to have to look at it. So the natural thing to do is to try to ignore it, right? But that's clearly the wrong thing to do, right? The patient's going to feel abandoned. They're more likely to litigate if you do something like that. So you need to be rolling out the red carpet. You need to be doing everything you possibly can to make this patient, to take care of this patient and make them feel like you're taking care of. Because really, perception is reality. You what they feel versus what you think. Ultimately, what they feel is.
That is where you fail the patient. You did not fail the patient on the complication. You failed them when you did not support them.
Yeah. I don't want to end on something negative. Could we?
Well, okay. So this is actually the most important, the most critical aspect when it comes to complications is shame resilience. And I get this from Brene Brown's work on vulnerability. And the 3 steps for shame resilience that I always, whenever anyone posts anything about a complication, I always post these 3 steps of shame resilience. Because the biggest problem we have with complications, you're never going to feel great about them. There's guilt, which is we feel bad about the event. And there's shame that we feel bad about ourselves. And, it's the feel bad about ourselves, that shame is where the true problem is. Because if you feel guilty, you'll want to gather people. It's people coming together and providing support. And that includes from the patient and includes from our colleagues. That we're open to hearing from other people because it's about the event and we want to understand about the event. We want to heal from the event. And shame is about ourselves. We don't want to be seen. We withdraw. We don't hear what the patients understand us. We don't hear from our colleagues that this could have happened to anybody. And so we never actually get any kind of feedback or help. So shame resilience is what you really want to focus on, because you want to be able to move that shame to simply guilt. So then you're open to be able to heal from this event. And so shame resilience is 3 steps. And one is reach out to a trusted source. Now that could be, online in some of these groups, or a friend or a trusted colleague. It's reaching out to someone that you trust and share what you feel. The second is talking kindly to yourself. is recognizing when you're not being very kind to yourself. Would you tell your colleague this? Would you tell yourself as a child this? Like, are you talking to yourself kindly? And the third, and this is kind of going what we were talking about, is owning the story. You want to own the story so you can own the ending. And when you have a complication and you own that, then you're able to own that story, which means you can own the ending. I can go and share that complication with the patient, and we can both find a way to move on versus never owning it. So then you're at the victim of whatever happens. And those three steps are easy to remember. And it's really, really transforming to be able to avoid that shame, which is going to put you in a shame spiral, versus guilt, which is going to allow you to heal.
Amazing, amazing, amazing. So if people want to learn more about, you have courses for a lot of the stuff that we talked about today, right? You've got your courses, you've got the Boss Surgery podcast, you do coaching, and you close people's holes. You close holes too. So
take things out too. If there's any gallbladders left, I'm not so sure.
You've gotten to most of them already. So if people want to find you, where do they find you?
BossSurgery.com is probably the easiest place to find me. I also have a Facebook group, Boss Business of Surgery Series, and feel free to join. It's free. And that's the main way to find me.
Fantastic. Dr. Amy Vertrees, thanks so much for being on the podcast.
Thanks, Dr. Block. I appreciate it.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. He can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, please be sure to leave a 5-star review on your preferred podcast platform. We'll see you next time on the Physician's Guide to Doctoring.